support groups that you can sign up for on Zoom. And we've got a lot of wellness and health programs and things that you can participate on video in groups. And so we try to create some level of socialization to bring people out of that isolation.
Unfortunately, we are running out of time. So Dr. Coots, you get the last word on that. I want to thank everybody for joining us on this edition of Homefront. This is a very special group that we've had, probably the most high-powered overall. So I want to thank our special guests, Dr. Charles Vaselis, Dr. Norvell Coots, Dr. Shay Lott, and Wayne Miller. Every show, we try to bring you another look at the people who have been serving our country and the people who are serving them, like our special guest today, and give you that additional viewpoint. I'm Mike Subin, and on behalf of the Montgomery County Commission on Veterans Affairs, I want to thank you for joining us.
Three, two, one. All right.
This is a project effort, and it's an important that projects like this be successful. They can only be successful through the work of a dynamic team, and we have that here. So if I have failed to recognize anybody, please forgive me. This project's been going on for 2 years now. Took a while after my foot fell through the floor, but once we got it started, it's actually gone very, very well and pretty quickly over the span of 2 years. Over 37,000 square feet.
I just want to say, government workers tend to get this bad rap because you're a bureaucrat. You work at a desk, you do a job, you push paper. People are as passionate about what they produce as just sitting in the desk doing the job. You don't realize how many of the staff, and I learned this a long time ago when I walked into a federal office building and started talking with staff workers, and they were talking with great passion about what they were working. They weren't just people who worked for the government, had a lifetime job, and all the horrible things you hear. They care about it as much about outcomes as they do about the jobs themselves. And I'm just really happy that we've got staff here that really cares about what they produce, and that it really matters that this is going to be a success and going to make a difference. And I've gone badly off script, and my staff is probably really mad at me, but I think it's important to point that out to people, because these things don't happen right if people don't care. And I just want to emphasize that. So this really is a significant day for Montgomery County. Substance use disorder is a lifelong struggle for those who are afflicted by it. It doesn't go away easily. And people will spend their lives trying to stay in recovery. And that is a perpetual state of being. It is not something that happens in the moment. And so while we've made great strides in destigmatizing this, and it's important that we destigmatize this is no different than any other illness that people encounter. It needs to be treated as something that happens to people, not as something that somebody has done wrong. And when you're addicted, there's no easy way out. This society has a great deal of responsibility for the rates of addiction. When you think about the opioids and the criminal activities of major corporations in terms of making sure they could pump these drugs into the community without a thought for where they're being used. I think you all have seen the stories about jurisdictions where they had more opioids going into them than they had people there, and that nobody noticed that there was a bit of a discrepancy. Nobody could be taking these many drugs unless they're abusing them. So if you want to talk about, the people who've been victims of this, we need to talk about the people who create this problem as well. They have a responsibility, and we have a responsibility when we get the opportunity to prosecute them and divest them of the money that they took from people in the process of doing this. It is just wrong for the culprits who caused this to walk away from it as if, hey, not my problem. Well, it is your problem. The most effective way to manage and mitigate the negative effects is to have treatment, and to have consistent and solid treatment. And that's what we're going to be able to provide here. I'm so excited about the expansion in capacity I will say we probably need another building this size. I mean, we all know the needs exceed the beds. We've never had the beds in this county to deal with this. We've talked about a sobering type center that we need in the county for temporary. It is ridiculous that we take people and throw them in jail. It's ridiculous. We take homeless people who are suffering from substance abuses and mental health issues, and their behavior puts them in a jail instead of a treatment facility. So we're going to continue to work to try to fill out the programs we need to put in place. Nice wind. So this is really, I think it's an important place to go. The treatment center is going to be for county residents to seek treatment for substance abuse disorders, including alcohol and drugs such as the opioids. For more than 20 centers, for more than 20 years, the center provided residential help. As inadequate as it was and for all the flaws in the structure, it still did its job. It did it in a more limited way, but it did its job. And now we're going to provide a first-class, premier facility that makes it possible not only to do the job, but do the job better. People always say that, the environment you put people in, whether it's a school or treatment center, the quality of that building reflects the importance that you put on it. If I send a kid to school that's fallen apart, I send a message to a kid. If I send people for treatment into a building that's falling apart, I've probably sent a message about how we value it. So this building says a lot about how we value the work that's being done in there. And it also talks about our value of the public-private partnership. We could not have done this ourselves. We are all too aware of the limitations that we face as a county. They're real. We don't have all the money we want. This would have been stood up earlier. Just the fact that this started with UMA, and when David first came here, and we're opening it now, doesn't speak to a lack of interest, but it speaks to a lack of capital resources. And this county has been starved for capital resources for a long time. We're not able to do the things we should do, and that's one of the things that I've been working on to change that, because it's great to have goals. It's great to know what you need to do. It is horrible when your ability to pay for it is the thing that comes between achieving what you need to know, what you know you need to do, and not achieving it. So I'm happy we're able to do this. I also want to say I really appreciate the treatment centers, Maryland treatment centers, for their participation in this, and the state of Maryland. I mean, the governor and I disagree about some things, but there are things we have no disagreement on. And, this is one of those areas where he's been committed, we're committed. He was here, I think, at in the very beginning for the groundbreaking, and it was important to him. And I just want to acknowledge that, people disagree about some things, but we work together on other things, and it's important to see this as a cooperative project of both the state, the county, and our private partners. So I want to thank David for doing this. I want to thank PHF for borrowing $8 million. That is not insignificant, and so thank you. And to all the folks in Health and Human Services for your work, whether it's work here or whether it's work in that department. You all do an amazing job trying to make people come out better at the end of our interactions with them, and I just want to thank you for doing that. And I also want to acknowledge the families, because you bear the struggle personally. You know the struggle better than any of us do. And so hopefully we're an important resource for you. Hopefully this center will give you some hope, or greater hope, about what can be done to help us move this forward. And I just want you to know this really matters to me, so I'm really happy to be here.
While this facility represents brick and mortar, what goes on in this facility is truly magical, truly special, truly life-saving. And I want to next acknowledge and thank the incredible staff and volunteers and families and patients that will be coming through these doors, seeking help, seeking guidance, seeking leadership, and receiving love and care, and a facility that meets the standards and dignity of the families that will be walking across these doors that we will all have an opportunity to tour in just a little bit. This last year, yes, let's get applause that. This last year has been exhausting. It's been disorienting. It's been tragic. And we know that over 200,000 county residents have filed for unemployment since last year. There are tens of thousands of county residents who are in the queue to be evicted. And as chair of the Health and Human Services, we've been receiving regular reports regarding substance abuse challenges and behavioral health challenges in our community. And as we all can imagine, they are off the charts, levels of which we've never seen before. And so this facility has never been more important than right now. This facility is going to save lives. This facility is going to reunite families. This facility is going to keep families together. And so I am so proud to be here speaking on behalf of all of my colleagues, and I want to acknowledge Councilmember Sidney Katz, whose district we are in right now, who chairs our Public Safety Committee, which I have the honor of serving under. This crosses over into a variety of areas, public safety being one of them, going further upstream, preventing people from entering our criminal justice system in the first place. And I see my good friend John McCarthy in the audience as well, who's been a strong advocate for programs like this. And of course, I'm joined by my very good friend, Councilmember Will Jawando, who has really hit the ground running on the council and has been a leader in so many different areas, and this is one of them. Will recognizes in particular the importance of supporting the entire family through whatever challenges they face. And so it's an honor to serve with you, Will, and I'm happy you're here. And my colleagues, council members Hans Riemer and Evan Glass couldn't be here today, but I do want to spend a special shout out to Councilmember Glass, who leads our homeless and vulnerable population efforts on the council and does them extraordinarily well. And I know he wanted to be here today. And somebody let him know that I gave him a special shout out too. And then finally, in terms of recognition, and then I have a couple of other comments to make, I really do want to thank our state delegation, Delegate Resnick and Cheryl Kagan, who was here earlier, and of course our federal delegation represented here by Jenny and Congressman Raskin's office. This takes public-public partnerships for us to really be able to enact policies in a way that really makes sense. Not just in terms of resources, but addressing those barrier policy issues that make it more difficult for these incredible people to do their jobs, for these incredibly special families to get the support that they need. And so there's a lot of effort that is going to need to be done there as well. And next, I want to acknowledge our tremendous Department of Health and Human Services, led by my good friend, Dr. Raymond Kroll. He did something wise earlier this year and brought on board Dr. Rolando Santiago, who heads up our behavioral health division, something Dr. Kroll knows a thing or two about. And I know he was very judicious in wanting to make sure that that particular division was in good hands, and I think he's done an outstanding job. And I want to spend a special shout out to my good friend Uma Uluwalia, who's in the audience. Uma and I had the pleasure and honor of serving together in the previous administration for 12 years. I got to see her in action almost every day, and there were some weeks where I spoke to Uma more often than I did my own wife because of challenges in our community. The vision that she set for our entire community, and that's being realized today, is one of many examples of her efforts, and frankly of my previous boss as well, our former county executive, Ike Leggett, who put his foot on the gas on a number of capital projects that were supported by the previous council. Finally, I want to thank our county executive. Mark, you've had a tough year, and you have really risen to the challenge on many levels. I appreciate the way that you have supported the efforts of the Department of Health and Human Services, as well as all of our ancillary agencies, because it really does take a collective village and community to be able to holistically address the needs of everyone. So while this last year has been disorienting, exhausting, and depressing in many levels, I'm settling on hope. I'm settling on hope that we can tackle the challenges before us, that we can build on the system building that we need to help address the holistic needs of these families before they're in crisis, and certainly wrap them around with love and care when they are in crisis. I'm also hopeful about the future of this county. We have a lot of challenges ahead. What is becoming clear is all of the ramifications of this last year, behavioral health and substance abuse being two big ones. But I'm confident in the team that we have in place, and I'm confident because of days like this that better days lie ahead.
Thank you for County Executive Eldridge for all your support this year. It has been an amazing year and a pleasure to serve with you. And the members of council, thank you all for all the help and support and encouragement that you've given to me and to the Department of Health and Human Services and to all the folks in the county who have been working throughout this year to bring us back to this point in time where I can stand in front of you without a mask on and we can shake hands and we can hug again. Now, what an amazing day. We're working our way out of this pandemic, and that is unbelievably special for me because it has devastated our community in so many ways. Addictions is just one of those things that we have seen as a result of increase as a result of this pandemic the last 15 months. It's not been kind. Montgomery County alone has had a 25% increase in the number of human beings, of lives that have died due to opiate overdose in this county. That is an amazingly tragic number, despite our best efforts. The pandemic isolated people, cut them off from recovery, cut them off from their supports, and left us with nothing else to do but sit around and look. And for persons who are in recovery, anyone who's been in recovery will tell you that boredom is incredibly dangerous. Boredom and isolation are incredibly dangerous pieces when you're trying to recover from an addiction. This building and the services that are in are evidence that the county did not forget that there were people out there struggling and battling addiction and battling for recovery. And while COVID slowed it down a little bit, it didn't stop us from keeping going. And this has been a labor of love and compassion for a lot of people here. The advocates in the community who put the state of that old structure on the map and front and center in front of council. And I want to call out especially Ed and LaTanya Rich, who are sitting in the audience today, who shared with us, thank you both for and the advocates and your fellow partners who made the difference in this. It was the advocates who first put this on the radar and kept it on the radar and said, no, we can't treat people in a building that David Dice has put his foot through. We can't treat people when there are animals coming in from the ceilings and when there's rain falling in from the buildings and when plaster's falling apart. That building was in deplorable shape. And the team who was in there treating people managed to do what they did in spite of the condition of the building, instead of by being supported by that space. And our advocates made a real difference in that. So I thank you all again for that. You'll be amazed when you see this building by what's transpired. You know, those conditions were unimaginable 5 years ago, and it was dreary, to be quite honest about it. So it represents a major step forward in how we help our neighbors recover and fight this group of addiction. Fight the grip of addiction. The physical space alone speaks volumes to people who are coming through its doors about hope and optimism and a first step in their journey for recovery. The grounds are beautiful. They were beautiful to begin with. They're even better now. If you go around the building, the back of the building, you'll see some of what I'm talking about. And I'm a psychologist, so we know that physical space matters. The space you live in, the space you breathe in, the space you commune with people in makes a difference. And this is going to be one of those places that makes a difference in people's lives. But the grounds beyond this, the grounds are not the only thing. It's what happens inside those doors. I think the Councilmember Alvarez has mentioned that is magic. We have changed how we operate here in this campus and how we operate in the county. This is a starting point for people. They come for detox and they come for inpatient care. But now they can transition into outpatient care, things like medicated assisted treatment, things like mental health and case management and all the other recovery services that they need, where they used to have to go someplace else to get. They can now start that process and that journey here. One of the most dangerous things about recovery is that transition from one phase to the other, where people have finished their detox and they go back out and they got a week's wait to an outpatient appointment, and in that week there's a lot of danger for folks in recovery. This is a place where folks can get support in those first days and those weeks and those months, and they can transition to what they need to keep them on that path of recovery. This project would not have been possible without a lot of key players, and some of them have been named, and I'm going to rename some of them for me. Uma Alawalia, who was the former director and my boss when I got here as Chief of Behavioral Health and Crisis Services, who made a reference to it and said we need to do something about this space, and who sent me up here on my journey to understand what's happening in behavioral health. And I looked at it and I thought, this is funky, to say a word, to use a clinical term. Dick Kunkel. Dick, where are you? Dick Kunkel. Give him a round of applause, people, please. Dick Kunkel was my deputy when I got here and was the head of the addictions branch of behavioral health, and he made good and well sure that I knew that this was a space. He took me to every addictions treatment spot we had in the county and then saved this one for last so I could see what kind of condition it was in compared to some other things we were doing. He kept it on the radar. He had an initial vision, and we owe Dick Kunkel a couple of other things, the help in building and standing up a drug court for county residents as well. A whole series of things that are too numerous to name, but he kept this on our radar. And he, and along with the advocates, he had a grand plan. And Mark, I think he had a plan that probably rivaled what you envisioned. We didn't get quite there, but we got someplace. We got someplace that's important for us. Casa Seyon, Casa, where are you? I don't know where Casa is. There he is. Among the DGS staff, Casa was one of those people who was a problem solver. He taught me more about doing couples work than I ever knew as a therapist. Figuring out how to split the ground and negotiate and navigate between all the warring factions that were in that room to try to make this work and finding a solution. He's a problem solver. Thank you, Casa. And Rachel Silverman, where are you, Rachel? I saw you a second ago. She's out in the back from Office of Management and Budget. Incredible partner, trying to figure out how we pay for this, how we make the money work to get this done. And I want to also acknowledge Ahmed Awad, who's here from the state today, and his help in figuring out the funding and the money for this system. All of those folks, they came together and solved problems for several years before we ever broke ground on this building to make this possible, and I thank them. And also, I saw Jenny Vitus out here, who was one of my team members and staff members. Jenny, who was also here making a difference in that team and figuring out how to solve problems. And last but not least, the team at Potomac Health and Maryland Treatment Centers, Rebecca and Mark Fishman, who are out here in the audience with us today. Megan Westwood, who's there. Megan, raise your hand. Come on. All right. And Bill Roby. This group has been the group that make public-private partnership made it live. Before we ever started this building, they were working to make life better for the folks and working in partnership to provide treatment and services to our residents. This building marked a whole new level of partnership. And their genius in creating and crafting with Dick and other folks what goes on inside these doors is going to be something that will be with us and be helping us for years to come. They have been a vital partner for years, and I'm looking forward to this work with them going forward into the future. I'll end by saying this. This center stands as a visible commitment of Montgomery County leadership, the leadership of the community, the compassion of the community, and the caring of advocates and staff across this county to combating addiction and supporting recovery. There's hope inside those doors. And if you have family members who need it, send them here. We want them here, not in the jail. We want them here. So bring them. Thank you all for coming out today.
This project has been a very long labor of love. We had to dodge a lot of bullets to make it happen. We had to win 2 different RFPs. We went through 2 different contractors, and then there was COVID. Nonetheless, we prevailed, and here we are today. There are 2 important takeaways I'd like to point out about our Avery Road Treatment Center. Number 1, the public-private partnership, that model works very well in the business of helping people. Potomac Healthcare Foundation and the wonderful folks at Montgomery County DGS and HHS work together as a true team to make this project a reality. As we succeeded here, we can replicate this project in other districts, counties, and regions where there is a great need that isn't being met. Number 2, all people deserve to be treated with respect and dignity, not only the rich or well-connected. Too often, the only choice our patients have is a treatment center that is run down and falling apart, much like our old building was. What our team created here is a treatment center that is beautiful, clean, and welcoming. It says to the patients that come here seeking help, welcome. Addiction is a disease, not a crime. You are worthy of our respect, and you deserve to receive treatment in a surrounding that reflects that we care about you. With that, I also would like to thank everyone who made this old dream a reality. Bill Roby from Potomac Healthcare spearheaded this project for us. David Dice, Casa, Beiruz, Mark from DGS, all of the folks at HHS. our architect, and of course, David Costello. Thank you very much. Michael Benedict from Equal Bank, who made sure we got our financing extension after extension. But last but not least, I'd like to thank the staff of Avery Road, and especially Megan Westwood, Executive Director, for continuing to treat our patients throughout the long construction period and throughout the pandemic.
But I do want to circle back and sort of highlight this extraordinary collaboration that we have enjoyed as Maryland Treatment Centers and Potomac Healthcare with the Department of Health and Human Services for over probably close to 30 years, if I'm getting it right. And particularly with Dr. Krull and Dick Kunkel, I want to say thank you. You have been my colleagues, my friends. We have had this dream, I think, Dick, probably 10 years ago. We were sitting about where you're sitting now in my office, dreaming about what it would be like to rebuild this building. Dick has been a tireless advocate. Raymond is a tireless advocate. Despite all that his challenges that are thrown his way, he has kept his foot on the gas in relation to the opioid epidemic, to how we treat people who are struggling with this disease of addiction in a compassionate way. But I also want to take some time, and obviously there's so many people in here that we have acknowledged, the advocates, all the people who made this happen, but I really need to spend some time to talk about the staff and of the Avery Road campus, not just Avery Road Treatment Center, but of this campus. They're remarkable. What they do is not easy. It's exhausting, sometimes disheartening, sometimes sad. And they show up every day with a message of hope and optimism. They truly are remarkable, and I am a lucky woman that I get to come here every day and spend time with them. They make me look good, and I'm so incredibly proud to be part of this team. I particularly want to acknowledge Emmanuel Nusta. He's filming at the same time. Emmanuel is the heart of this operation. He truly is. He's spent about 17, 18 years as the director of nursing. This year, he assumed the responsibility of the administrator of Avery Road Treatment Center. And just to welcome into his position, we said we're going to move the building, create a huge construction project, move you across the street, and just for fun, we're going to throw a pandemic in there. So, but he is, if you have not had a chance to meet him, I hope you will. He shows up. He is a leader with grace and compassion, and we are so lucky to have him. And as a reward, this year he will get, after almost 20 years, an office with a window. Well deserved.
For over 10 years, I struggled with the disease of addiction. After countless efforts, I stepped through the doors of, the old facility for the last time almost 4 years ago, completely broken and hopeless. It was not my first time in treatment, and I didn't know if it was going to be my last, but through the support of the peers and staff here, I've been able to succeed in recovery. Although we've all faced many challenges over the past year, it has been extremely difficult for those who struggle with addiction and mental health. The lack of in-person treatment and meetings, inability to get support from family and friends, isolation, loneliness, financial hardship, they've all caused a drastic increase in substance use. Last summer, I was given the opportunity to give back, and I started working here at Avery Road. Shortly after, I was offered a position on the STEER team with Maryland Treatment Centers and continued working towards my certification as a peer recovery specialist. We work closely with EMS, hospitals, and the crisis center. We respond to overdoses and those most in need. When patients come to treatment, their self-esteem is completely shattered. To me, this new building sends a clear message, and that's that you are worth it. It gives you hope and a reminder that people do care about you and you have a life worth living. It is truly a fresh start for patients and their loved ones to begin their journey in recovery. This will provide an opportunity for even more people to get the help they need and will ultimately save countless lives. As a former patient, current employee, and a peer to those just coming in, I'm so grateful to be a part of this experience, and I'm so excited to see all the amazing things that are to come. Thank you.
fight against coronavirus isn't over. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. And wash our hands frequently. Let's move forward together. Learn more at coronavirus.gov.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
The COVID-19 vaccines can be our chance to get back to our plans, to get back to each other, to life. But it's okay to have questions, like, can the vaccines give you COVID-19? You cannot get COVID-19 from a vaccine. Find the latest information at getvaccineanswers.org.
Un espacio informativo para que usted obtenga acceso directo a los servicios de su gobierno local. Aquí da inicio Montgomery al